Hi, my name is Rosemary. I'm a 28-year-old gravida 3 par 2 patient being admitted at 38 weeks to labor and delivery for a scheduled C-section tomorrow morning. I found out at 20 weeks my diagnosis was oligohydramnios and fetal bilateral renal agenesis. I have no idea what that means, but they tell me that I have no amniotic fluid and the baby has no kidneys. The doctor suggested that I terminate my pregnancy at 20 weeks because there was no chance the baby would live after birth. But I chose to keep the pregnancy because ultrasounds can be wrong and they don't know everything. So here I am, ready for my C-section tomorrow.
Hey Rosie, how you doing? Are you ready for that C-section tomorrow morning?
Not really. I'm really scared. I don't know if the baby's going to be born alive or not.
Rosie, I told you at 20 weeks that this pregnancy didn't have a chance. This baby is not going to survive. I don't know why you chose to put yourself through this.
But the ultrasound could be wrong. The baby could be born alive. So I want to have the baby. I want him to be alive.
Rosie, you have about this much amniotic fluid and your baby has no kidneys. This pregnancy never had a chance. This baby's not going to make it.
You guys don't know that for sure. He could live.
All right, I could give you something to help you relax. How about that? Does that sound good? Nurse, I'm going to put an order in for diazepam, 2 milligrams, PRN. So I'll go do that right now, okay? Rosie, I'll see you in the morning. You take care now.
All right, blood pressure 188/98, heart rate 110, and respirations 26. All right, everything looks fine. I'm going to be leaving for the night, and your new nurse will be in soon. So if you need anything, just call to the desk, and someone will come help you.
Yeah, the tech on the floor tonight. I got room 123.
Really?
Yeah, why?
Well, I was just in there, and I heard the doctor talking, and apparently she found out at 20 weeks that her baby wasn't going to make it, so had no kidneys, but she carried to full term.
Are you kidding? Why would she do that? Why would she put herself through all those stretch marks and the weight gain and the complications? If I was her, I would have terminated that pregnancy when I found out.
Yeah, and she's on main care, so guess who's picking up this tab?
Us. It's going to be a long night for me tonight.
Good evening, Rosie.
Hi.
My name is Laura. I'm going to be your nurse tonight. Do you like to be called Rosie? That's what's on your chart.
No, not really.
No, what do you like to be called?
Rosemary.
Oh, Rosemary, are you okay?
No, I'm sad.
Oh, you are? Oh, I'm really sorry to hear that. What's going on? Can you tell me about what's going on?
Well, I'm having a C-section tomorrow, and nobody wants to support me having my baby tomorrow.
So you don't feel like anybody is helping you out here?
Not my doctor. She's really mean.
Oh,
I don't feel like she stood behind my decision to carry my pregnancy.
Well, Rosemary, I can tell you that I'm here for you because I'm your nurse, and I'm going to advocate for you and what you want and how you want to be taken care of here in the hospital. Rosie, I've been looking over your chart a little bit, but I'm a little bit confused because the doctor gave a prescription and put a prescription in there for diazepam. Do you know why he might have done that?
I was upset because she didn't want to talk to me about the C-section and everything, so she just said, well, I guess I could give you something because I was upset, so I don't know, maybe that's why.
What were you trying to find out about the C-section? Do you understand what's going to happen?
Well, I understand everything that's going to happen during the C-section part. I'm nervous about what's going to happen to the baby, like if he's going to come out alive or if he's going to come out dead, or I'm just scared.
Okay, so I hear that you're really concerned about how things are going to go tomorrow when you go through the C-section. You're not really sure what to expect, so
right.
Well, we're not really sure either, but I can tell you that we'll make sure that you're not in any pain and that the baby's not in any pain, and we'll make sure that it goes as smoothly as possible, and we'll just have to take it minute by minute. Does that sound okay? And if at any time you don't feel comfortable with what's going on, we'll stop everything and try to figure out what you need. Okay, and I'll be there too, so
Good.
and I can talk to everybody else on the team and make sure that everything goes smoothly, okay?
That would be great, because
Sure.
nobody wants to help me, it seems like, so
Did you have your husband here too?
He'll be here later.
Yeah.
He had to go home and take care of the other kids.
Okay. Okay. So you have how many others?
2.
2. And do they know what's going on with?
They don't.
No.
They don't. They know that I'm having a baby, but they don't know
Okay.
the end result.
Okay. Well, I would encourage you to talk to them because kids are very good about these sort of things, more so than we expect them to be, and you know, that would be good for you to be able to express to them what's going on.
Okay.
So, Rosemary, just want to let you know that I haven't been through what you're going through, but I'm not really sure what you need, and everybody's a little different. So if you need anything, I want you to ring your call bell for me. I want you to call me. I'm here only, so if you need to talk some more, I want you to contact me. I want you to think about what you want for tomorrow, okay, for the outcome of tomorrow, okay?
Okay.
And did you talk to the doctor about the baby's survival possibilities and whether or not the baby's going to be okay, or do you need some more clarification on that?
Well, he's always stood by that the baby's not going to live, so I would like to know what's going to happen if he does. What are they going to do?
Okay.
You know, what are our options?
Okay. Well, what I can do is I'm going to have the doctor give you a call, okay? And
Okay.
Or come in and give you some more
Can you
information.
come in with him?
Sure.
I mean,
Yeah. So, Rosemary, what I'm going to do is I'm going to go talk to the doctor and try to get some more information about that for you, so we can have a really good picture about what's going to happen tomorrow,
Okay.
and you can be prepared, and we can make some plans. Okay. So I think it will help you if you have some plans.
I do too. I think that would be very helpful.
Okay. So that sounds good.
Yes, thank you.
Okay. You're welcome, Rosemary. So please let me know if there's anything else. You have
Okay.
your call bell?
Hi,
Hi.
I'm Jordan. I'm the CNA on tonight.
Hi.
How are you doing?
I'm good. I'm doing better.
That's good. I'm gonna grab a set of vitals on you real quick. Is that all right?
Sure.
Have you met Laura yet, your nurse?
Yes, I have.
Good.
She's really nice. Do you like her?
I like her. She's a great nurse.
Good.
You're in good care.
Finally.
That looks good. It's 120/86.
Oh, good. Is that normal?
That is normal. Just gonna check your pulse. That's 76. And your respirations are 12, which is all normal.
Oh,
All
nice.
good. That's very good. Is there anything I can get you right now?
Whenever you get a chance, just get some water, please.
Let me go grab some for you. I'll be right back.
Thank you.
You're welcome.
Good evening, Dr. Wood. This is Laura. I'm calling from the hospital about Rosemary Watson in room 123.
Yeah, Laura, what's going on?
This patient was diagnosed with oligohydramnios and fetal bilateral renal agenesis. Her vital signs 4 hours ago were 188/98, a heart rate of 110, and respirations were 26. Then now they were just taken and they were within normal limits. And this was right after I had been in and talking with her for a little while. And I'm calling just because I have some concerns about her. My assessment of this patient is that she's experiencing some anticipatory grief, and along with that, some unrealistic hope that this birth is going to be viable. And due to her knowledge deficit related to this pregnancy and these outcomes, I'm really concerned for her having some unexpected problems tomorrow dealing with whatever happens. Also, she stated that she's feeling unsupported, having carried this baby to term, knowing about the birth defect, and she's having now some trust issues and feels unsafe with her care. And another thing also too that I wanted to bring up was that there's a prescription on her MAR for diazepam, which is contraindicated in pregnancy. And I'm also kind of questioning whether or not this med is necessary to stay on her MAR, because she seems to be doing a little bit better after speaking with her. I'm wondering if we could maybe provide her some education on this situation and I recommend getting some grief counselors involved and some other interprofessionals involved because it's such a complicated case. And support her with some more education on all the outcomes for tomorrow so that she can make a birth plan that will support whatever the outcome is, and remove that medication also again too. Does that sound all right with you, Doctor?
Sure, Laura. I can come in and talk to her tonight. I have a couple more patients to see this afternoon, so before I leave for the day, I can come in and talk to her and make sure I go over the expected outcomes, all the possible situations that could happen. As far as I'm concerned, there's only one outcome here, but I understand, and thank you for pointing out to me that this is the patient's first experience and only experience with this, and therefore she has a lot of questions that perhaps I haven't answered and could give her better information on, so she can maybe relax more tonight and handle the situation better tomorrow. Would you let her know probably about 8 o'clock I could be in?
Yes, I'll let her know, Doctor, and I think she'll relax a little bit after you come in and you speak to her. I appreciate you doing that.
Sure, no problem.
Thank you. Have a good night.
Good night.
Bye.